Healing Hands Health Society presents Dental Webinar Series. We have planned a series dental webinars to keep you abreast of current practice. This series on prosthodontics will be via Zoom, Facebook Live. Presenters are drawn from dental schools in the USA, private practitioners from around the world. To register for future webinars, visit www.hhands.org/dental-training. For future inquiries, contact Facilitator.
Farhat Judge received his dental degree from the University of Baghdad in 1998 and his prosthodontic specialty training from the University of Michigan in 2007. His practice is limited to prosthodontics and dental implants and is currently director of the Graduate Prosthodontics Clinic and is a co-director of the pre-doctoral dental implant education at the University of Michigan School of Dentistry. Before you know it, Dr. Farhat Judge, we need to get him to help us as we decide on developing a curriculum for pre-doctoral students. He's already doing that. He teaches pre-doctoral dental implant education at the University of Michigan. He's a member of the American College of Prosthodontists and a member of the Academy of Osseointegration. He's also a member of the International and American Associations for Dental Research. He's also a fellow of the International Congress for Oral Implantologists. His research interests are in the field of dental implants, dental ceramics, and the utilization of CAD/CAM technology in dentistry and research. He has published numerous articles and abstracts in scientific journals and meetings. He also serves as a reviewer for multiple scientific journals. Thank you so much, Dr. Farhat Judge, for your willingness to participate in this webinar series. Please, over to you.
Thank you, Dr. Uvo. Thank you all for inviting me to speak in this webinar series. I am very glad that I am part of this. It's something very good that Dr. Uvo is doing, and I'm sure it's helping a lot, and hopefully this advances to something a lot bigger. So today, because of the limited time, I'll try to be quick just to allow any room for questions. But basically, when Uvo asked me about talking about something that related to dental implants, I thought I would do something that I do on a regular basis, and that's custom abutment design. And so I'll go through a very quick introduction. Let me just make sure. So it's working now. So I'm going to first talk about a few, basic information, and then we'll go into a quick classification of what types of abutments we have, and then I'll do a design demonstration of a custom abutment on lab software, just to give you an idea how I design my custom abutments to custom fit every patient. What are the principles that I follow, and what do I look in a custom abutment so that it gives me the ultimate aesthetic and functional results. Okay, so basic information. Basically, everybody knows what a dental implant is. It's a prosthetic device made of an alloplastic material that's implanted into or over the oral tissues, and it's used to support or retain a fixed or removable prosthesis. The type of implant restoration that I'll be focusing on today is the cement retained crown. So we'll be talking mostly about the single implant restoration and the cement retained type. That's why I'm focusing on custom abutment for a cement retained restoration. So a cement retained restoration, implant restoration, consists of the implant, the abutment, and the crown. Types of abutments, they could be classified in different ways. It's either a one-piece abutment, where the abutment and the screw are all one piece. In this case, you can see that because they're one piece, the entire abutment is screwed into the implant, so there is no indexing design here. There is no hex, there is no trilobe that locks into the implant. So this is a one-piece abutment. I would say less common than the two-piece abutment, where the abutment has some sort of a geometry, a connection that locks into the implant so that it doesn't rotate. It's an anti-rotation design. And from there, there is a screw that goes through the occlusal hole of the abutment to secure the abutment to the implant. So that's one way if you look at abutments, either one-piece or two-piece abutments. The other way we look at abutments are either prefabricated or stock abutments or custom abutments. Prefabricated abutments come from the company in different sizes and shapes, and you select the one that fits your patient, fits that scenario the best, and you work from there. The second one is where you customize each abutment to custom fit your patient, and that would be one that I use the most, if not for all of my patients, because every restoration has to be custom made for that patient, and including the abutment. So if we look at the types of custom abutments, there are so many ways we can make a custom abutment. One, you can take one of those prefabricated stock abutments and then customize it to make it fit your patient even better. So you take a stock abutment and you try it in, you place it on the model, you customize it, almost consider it a crown that you're going to prepare for a crown. So this is your tooth preparation, and it looks in the mouth as if you did a crown preparation. Some of the preparations are done intraorally. Most commonly, they're done on the model, and then the crown is made on it. So that's one, but it has limitations because you're still working with a prefabricated abutment with a specific shape and then customizing it, so it might not have the best shape to fit that patient. The second type of custom abutments is what we call a castable, gold castable abutment, or a UCLA abutment. And that's where you have an abutment that comes from the manufacturer with a gold base that fits over the implant. And then there is a plastic tubing where the lab will wax up the shape of the abutment and then invest it and cast it. That way you can get your final abutment exactly the way you want to. Because of the gold cost, because of the additional lab procedures, that nowadays is less common as it used to be before, when this was our only option for custom abutments. The more common type of custom abutments that I use, and even most labs would use nowadays, is a CAD/CAM abutment, an abutment that is designed by a software and then milled to simulate that design. That way it's CAD/CAM, so designed and then manufactured. So the goal is to produce a custom abutment. As I said, all of my cases, I use a custom abutment to restore because it's hard to find a stock abutment that would perfectly fit that case. So if we compare the custom abutment to a prefabricated or a stock abutment, you can see that in the case of a stock abutment, you're working with a pre-formed shape that you select the abutment based on what the manufacturer selection is. So in some cases, you might not be able to find an abutment that would put the margin in a cleansable area. So when you cement, you might have too much cement left behind, as opposed to the custom abutment, you can customize that margin to be placed wherever you want to. The second thing is that the contour of the abutment might not give you the ideal emergence profile for the restoration you're restoring. For example, you might use the same abutment for a molar, a premolar, or an anterior, which will have the same emergence profile. But all of these teeth differ in the shape of their emergence profile and the contour and the size of the crown. So that's why doing a custom abutment will allow you to create that emergence profile that is appropriate for that restoration. And the third thing would be because of the preformed shape of the prefabricated abutment, sometimes the thickness of the restoration in some areas might not be ideal for that restoration. While in a custom abutment, as you're shaping and designing the abutment, you have to keep in mind the final restoration and the requirements for that final restoration material, so you give it the right thickness and the right area. So there's a lot you can accomplish with a custom abutment to achieve the ideal results that a stock abutment has limitations for. So the next thing would be showing you my steps that I take in designing an abutment, so that if I was doing a molar, I can get a result almost similar to what you see now on the screen. Okay. Now, I was telling Dr. Uvo earlier that because of time limitation, I will not go through the scanning, but I will show you scanning, what resulted from the scanning. So basically, I'm taking a case, and let me show you in my small screen. This is a patient that is missing tooth number 5, depending on the numbering system that you are using. For us, we say this is number 5. Other systems would be 1, 4, or other systems would be the upper right number 4. So whichever it is, hopefully you know which the upper right first premolar that we're replacing. The scanning system that I'm using is made by 3Shape. It's an intraoral scanner, Trios 3. And basically what I did here is that I scanned the right side of the patient to design a custom abutment. So first I scanned the mandible, then I scanned the maxilla, and here's the maxilla. And as you can see in the scan, the shape of the soft tissue usually will be the shape of the healing abutment that you removed at that point. So the soft tissue after the implant placement will take the shape of whatever you've placed on the implant. So if it's a healing abutment, it will be shaped as a healing abutment, which does not necessarily mean that's the shape of the emergence profile you want to create for your final restoration. And then finally, we scan the scan body. The scan body is your implant impression coping or impression abutment used for digital scanning. So just like you connect your impression coping and then you take your impression, in an intraoral scanning scenario, you use a similar thing, but it's made only for intraoral scanning. The reason is that there is a library of those scan bodies in the software, so it can recognize the implant system, the implant connection, timing, and orientation, and so on. And then finally, we take a bite registration. And as you can see, here is our bite registration. Now, if I was doing a full restoration in occlusion, I would scan the entire arch. If I am doing only a custom abutment, I need just that one side, because basically I just need to know the clearance that I have to give for the occlusal thickness of the material. So at this point, this scan is sent to the laboratory. The laboratory will design the custom abutment. However, I have the laboratory design software, so I use it myself and I design my own custom abutments. So I'm going to jump into the design software. And while I'm doing that, if there's any question, I'll be happy to answer. This shouldn't take that long to there you go. So let's share this screen too. Okay.
So there's a question for you here.
Okay.
So what material is the abutment made of?
So you select the material of abutment of your choice. You have titanium, you have zirconia. It depends on what the milling lab is using. So in my case, I use titanium for almost every case. And some people like to use zirconia abutments, ceramic abutments in the anterior region so that there is less dark shadowing through the soft tissue and through the crown. I have worked with the lab to try to get some techniques where I can mask a lot of that shadowing that we get by adding a gold hue to the titanium abutment. So the abutment comes out yellowish in color, almost like a yellow gold, let's call it. And then adding an opaque to the coronal portion of the abutment. That way, even if you do a ceramic restoration on top of the titanium abutment, there isn't that grayish background to the restoration. So with these, I can guarantee that I can control the aesthetic challenges that we might get with a titanium abutment, but also I can have a solid abutment that has less chance of fracture compared to a ceramic abutment. Okay, so now I'm going to show you the okay, let's see. Okay, so this is the scan that I received. So let's assume I was a lab. In my case, I'm working as a lab. I have received.
I'm not seeing your screen. Is just dark. We're not seeing your screen yet.
Let's see. How about now?
Yes, yes.
Okay. So the lab receives this scan that I scanned intraorally or of a model, and I sent it to the lab, and the lab now will start designing the custom abutment. Okay, so this is the design software that I use on a regular basis to design all of my custom abutments. And basically, as soon as you open a case, it starts importing the scans one at a time, just in case you needed to make changes. Okay, so here is the scan of the maxillary arch. If there are any changes that I need to do, if I need to trim anything on it, I would do it. So as you can see, there are those markers if I wanted to do any trimming. But in this case, I'm not changing anything. Everything has been trimmed nicely. And
while we're waiting for that to come up, there's a question here that says, is there any contraindications for CAD/CAM custom abutments?
let me see. Just one second. So contraindications to
for CAD/CAM abutment.
I wouldn't say that there is any contraindication. If you have a good scan, if you have one second, let me just fill out some of the information. Yeah, if you have a good scan, there is no contraindication. Actually, there is more freedom in designing your restoration with a CAD/CAM restoration compared to a UCLA abutment or any other type of abutment. So for some reason, let's see what's going on here. Okay. So I think Dr. El Abrashi is, there was a little bit noise coming and could be from there. Okay, so here is our mandibular scan, and you can see there's a scan. I don't need to make any changes on it. So basically, I'm importing the scans, and Occlusal alignment. For some reason, the occlusion did not get imported. So, okay. Now we can do manual alignment if I wanted to. Now, it's not that easy, but for some reason, when the case got imported, I think something happened that probably in the sharing or something that happened. But I'm going to assume that I'm going to get this as close as possible. And this is something that the lab has freedom of doing. Let's say the lab saw that the articulation was not perfect that the dentist sent. They have the freedom on changing the articulation in case it will fit the patient's occlusion better. So here is our articulation. And then I'm going to go to next.
What's your screen showing? Because mine is still where you started from.
Really?
Yes.
Okay, let me see. So I'm going to try to share my entire screen.
Yeah, I think so. Yeah, this work. I can see it now.
You can see it now?
Yes.
Okay. So this is a very important step that I do in custom abutment design. So now that I've imported all the scans, now I can modify the soft tissue contour to fit the design that I want for my final restoration. So as I mentioned before, the scan captures the soft tissue contour, which looks like a healing abutment contour at this point. However, if I was using a stock abutment, the stock abutment would probably have this contour. But imagine a premolar has a completely different outline than this healing abutment area. So what I need to do, I need to create the contour of a premolar so that my custom abutment has that contour from the soft tissue level, so that I can create what looks like a crown prep of a natural tooth for a premolar. So what I usually do, I take my adjustment tool here and I start contouring the soft tissue. And all I'm doing is I'm pushing the soft tissue in order to try to simulate what the soft tissue around the premolar should look like. This could be done with your provisional restoration. If you wanted to do a temporary crown on that implant and contour it so that the soft tissue takes that shape before you take its impression, or you can do it with your final abutment, especially if you're not making a lot of changes that would put too much pressure at once on the soft tissue. So I'm pushing the soft tissue to try to create that ovoid shape for my final abutment. And as you can see, now we're trying to change that soft tissue contour from a perfect cylinder that was the shape of the healing abutment to something that looks more like an outline of a soft tissue around the premolar. And you can see a little bit of roughness here and there that the software allows me to take my smoothing tool and then go and smooth all the soft tissue. And you can see in a second that I have contoured the soft tissue to look like what I want my my custom abutment to look like. Okay. Do you see now the soft tissue? If you look at it, it looks more of an outline of a premolar. I actually need to push the lingual, the palatal, a little bit more. So I can go back here and then push some more. And basically this tool in the software, it's a cutting tool. So basically it's pushing the soft tissue. And I go back and smooth it. Now, a lot of times I do this on the model. I don't do it on the software. Or if I don't do it on the model, I do it here on the software. So basically I created the soft tissue contour that is ideal to give my final restoration a more aesthetic and more natural look. And at this point, I'm ready to start building my custom abutment to fit into that soft tissue contour that I created. Okay. Now on the mandible, I don't have to do any modification, so I'm ready to go to the next step. Okay. The next step is lining up the scan body scan with the scan body from the library of the software. So as you can see, there's a flat side on the scan body. I just need to tell the software that that flat side is right here on the scan, and it will superimpose it. So we're going to do it again. Let's say this. Okay. So we're having some issues with the alignment. Let's see if this is going to work better here. So we're going to do a 3-point alignment. A 3-point alignment will give me a chance so that I can select 3 points and then do the same thing here. I think I did the opposite. Let's do it again. So 3-point alignment, this, and then this. There you go. So as soon as the two scan bodies are aligned, the software knows which implant system am I using, where is the implant location, and what is the orientation of the hex, the timing of the hex. You can see it already dropped an implant. I'm using a Zimmer 4.7 diameter implant, and it immediately dropped an implant, and there is the hex orientation. So once I know the implant location, orientation, now I'm ready to start designing my custom abutment. So here is the basic custom abutment that it throws in there, and now it's time for me to start designing it. So the first thing I do, I set where the facial is, where the lingual is to the software. So I'm telling the software that here is my facial, mid-facial, here is my mid-palatal, mesial, and distal. And now I start taking the margin, the crown margin restoration, and I like to position my crown margin about 1 millimeter subgingival for aesthetic reasons. So here is my distal area, here is my mesial area, and if you see this black line, this is a cross section of the soft tissue level. So I position this about 1 millimeter subgingival on the mesial and distal, and then I will turn it so I can start positioning it on the buccal also. So on the buccal, as soon as I click on the buccal, here is the soft tissue level on the buccal. So I'm going to take this down and bring it down so that it's hidden. On the palatal side, I don't need to position it subgingivally because the soft tissue on the palatal side, I mean the aesthetics on the palatal side is not as important. So I will position it at the soft tissue level or even slightly supragingival so that it's easier to clean the excess cement. And it's visible to where I can guarantee a full seating of the restoration. So far, I have positioned my margin level to the ideal margin position for my final restoration. The next thing I'm going to do, I'm going to create the outline of my margin area for my restoration. So we said it's a premolar. A premolar should have an oval shape and should be almost similar to the outline of the adjacent premolar. Okay, so I'm going to extend the lingual or palatal and the buccal, mesial and distal, position them where I think is the right position, and then I will start forming that oval shape of the restoration. Basically, if I know what a crown preparation of a premolar looks like, I'm trying to create it in my custom abutment. So you can start seeing now more of a appearance of a tooth preparation of a premolar. I take those corners and I position them correctly. I go back and basically I have created the outline of what a crown preparation of a premolar would look like. From there, I go back and I start looking in my adjustments. Did I alter the position of the margin? I'm still about 1 millimeter subgingival here. I'm still supragingival here. On the mesial and distal, I verify it and I'm still good. Okay, so I don't need to make any changes here. The next thing I do is I look at my occlusal clearance. Let me take this out of the way. Looking at the occlusal clearance. So if I make the opposing appear, now I have the option depending on my crown material. For example, if I was doing gold, I need minimal occlusal clearance. If I was doing ceramic, I would need 1.5 to 2 millimeters of clearance, and I would need the same thing for a porcelain fused to metal restoration. So based on that, I adjust my occlusal clearance. The software allows me to tilt the abutment either way in case my implant angulation needed to be corrected with my final restoration. Okay, so this clearance is sufficient. However, your crown preparation usually doesn't have a flat occlusal. So I'm going to take this abutment and I'm going to create my occlusal reduction to simulate an actual crown preparation. So now my custom abutment is starting to look more and more like a tooth preparation, and that's the goal. Okay? So basically, always have a tooth preparation design in mind, and you try to achieve it with your custom abutment. And so far, this looks very close to what a tooth preparation would look like. Now, I look at the occlusal clearance again, and it looks like I have enough occlusal clearance, and then make sure that my alignment is correct. Then I look at the buccolingual angulation to make sure, and this is a very good trick to do, is that you give some transparency to the model, and you look at the outline of the adjacent teeth, and you estimate, do I have enough clearance for my final restoration? Okay, if not, you can make changes. You can tilt this way or that way until you achieve the right reduction. Okay, so this to me looks like the proper coronal portion of my preparation. Now, the very important thing that I do here is that I go to the cervical part, the collar of the implant abutment, is that, as you see, it is really bulky, it is convex in some areas, and it's following the contour of the soft tissue that I created. Now, the soft tissue contour that I created was bigger, wider than the soft tissue contour that is currently in the mouth. And if I keep it that way subgingivally, it's going to put a lot of pressure on the soft tissue that, first of all, I might not be able to seat the custom abutment. Second, it might put too much pressure on the soft tissue, causing a reduction in blood supply and necrosis of the soft tissue. So what I usually do, I take my subgingival contour and I make it convex. That way, you can see all of this area. The pressure that I was placing on the soft tissue is reduced. So I take all of that, contour it, do the same thing here, which means the initial more cervical, more apical part of the abutment can fit in the soft tissue contour that is already there, created by the healing abutment, without any problem, without any pressure. The pressure will be applied mostly on the most coronal part of the soft tissue area. And that is to create the base for a crown that simulates a crown preparation, but without putting too much pressure on the soft tissue at the soft tissue level. So I go in and create this concave. Some people say that creating a concave shape might trap cement that would be very difficult to clean. So you have to be careful. By doing this, you have to make sure your margins are not too far subgingival. You're not putting too much cement. And there are some cementing techniques that would reduce any excess cement anyway, and that's something that we're not going to go into, but there are ways to reduce that from happening, okay? So this is my final contour of my custom abutment. So it's basically trying to create a crown preparation. So what we did is we created the shape of a tooth preparation. We placed our margins in the right position. We created the correct outline for the tooth we are restoring. If it was a molar, you know it's going to look more square looking. If it's a premolar, it's more oval. If it was an anterior tooth, you would have a triangular cross section at the gum line. So this is the goal, is create that at the soft tissue level, and then underneath try to create a convex surface that would not put too much pressure on the soft tissue, but it would gradually give you that emergence profile to the perfect outline of the custom abutment. Okay? And from there, we move on to the next step. And right here is where you can make a few changes to the taper of the abutment. So for example, if I thought this was too parallel, I need to add a little bit of taper. The software allows me to make a few changes to that. Buccolingually, the same thing. I can do the same thing. And as we said, if you wanted to create more space for the thickness of the crown material, again, some of these could be done. However, the more taper you add, the more you jeopardize retention and resistance form of your final restoration. So once this is done, you move on to the next step. And here is your screw opening for the crown. This is very important because sometimes, depending on your implant position, you might have a very thin wall on one side, and the software will give you a warning that you are too thin on one side, which is too weak for the type of material you're using. Once that is done, then the software does its final check so that it gives you the green light that this abutment is ready to be milled. And once you get that final green light, you can see the check mark here, is that your final abutment or your abutment design is good to go and it could be milled. The next thing is as soon as I hit send, I can send that design to the milling center. Obviously here I'm not going to send it, but basically what the milling center would get is the design. Here it is. Can you see this one, Uvo?
Yes.
Okay, so basically the milling center gets this file, and this file, they use a milling block that has the connection, and then they mill the occlusal portion to look exactly like this. So someone who asked earlier, and I don't think I answered the full question, is that is there a disadvantage or a limitation to the CAD/CAM abutment? Actually, I would say it's not this simple. It took me 20-25 minutes with some of the glitches we had with software to design this. it goes to the milling center, and then it gets replicated into the actual material. I receive it in a few days. So this gives me more freedom actually in designing the custom abutment the way I want to. I can visualize it while I'm designing it to create the shape that I need to create. And then it gives me a choice of different materials that the milling center can mill those out of. The only thing that you have to understand is that ideally you want to have the custom abutment milled by the manufacturer that makes the implants, because this is where you get the best fit of the abutment to the implant, because they have the exact dimensions and the shapes. Any third party would get very close, but it wouldn't be as good of a fit. Actually, some of the implant companies, they would void your warranty if you use third-party restorative components. So this is a Zimmer implant. I use Zimmer Biomet's milling center for those. If I was using a Nobel implant, I sent to Procera so that they mill it for me. Neodent, I send it to Straumann's. So I always use the manufacturer to mill for me the final abutment. So basically you have to have all of these libraries of the scan bodies and the implants in your system, so that whatever the implant system is, you can design and you can send to the milling center for them to mill for you. Any questions? I think I'm doing good with time.
Yes, quick question here. So was there any scan body when you scan the patient? Did you insert a scan body while you scan the patient?
Yes, so the scan body is placed at the time of scanning in the patient's mouth if you're doing intraoral scanning. In a lot of my implant cases, I take a conventional impression. So I do an impression coping, take my implant impression, pour it up, and then a lot of times I make the changes to the soft tissue that I did digitally. I do it manually on the model and then scan it. So I use my intraoral scanner on a model, and I put my scan body, which is right here. I put that scan body on the model, or it goes in the mouth if you were doing intraoral scanning, and then you scan.
Okay. So at what point do you think we should do tissue training? Because I see we're making changes to the soft tissue by contouring it on the software. But so is it when you have the healing abutment? Should that be the time where you kind of train the tissue to have a certain emergence profile?
So there are multiple ways you can do it. The ideal way is that once the tissue is matured, the implant is integrated, then you take the healing abutment off and you create either a custom healing abutment or a provisional restoration that has the contour that you want to create, or you gradually create that contour. So for example, if your healing abutment contour was this much, but you want to create this much of an emergence profile, you take a healing abutment and you customize a new healing abutment or a provisional restoration, and you enlarge it slightly. A week or two later, you bring the patient again and you add some more to it. A week or two later, you bring the patient and you add some more to it until you achieve the final contour. And then you scan the case.
Okay.
That way, you're not doing it all of a sudden on too much pressure on the soft tissue. In the posterior area, it might not be as critical. In the anterior, it's more critical because you want to capture the soft tissue the way you've molded it at the end, rather than guess how it's going to look like in the software, come to find out that this is not going to work out very well.
Okay.
Yeah.
There's a question here. It says, in Nigeria, we use mostly prefabricated abutments with impressive results. Considering the costs and the tasks involved in custom CAD/CAM abutments, do you think they are worth considering?
So I would say the prefabricated abutment, in a lot of the cases, you can make it work whether it achieves the results that you can get with a custom abutment, I would say in a lot of times it wouldn't. It will give you a good result, but a result that is doesn't reach the result of the custom abutment. In a lot of cases, the reason for that is that if your tooth shape is not close enough to the shape of the stock abutment, most of the stock abutments have a round cross section, and at that level, to create the contour of the crown all of a sudden, not in a gradual way that your custom abutment can create it for you, it creates that shape where the final crown looks like almost like a golf ball on a tee. Basically, this is your implant and abutment, and all of a sudden there is a bulky crown depending on the size of the crown. So the stock abutment has limitations, but because of cost, it's more commonly used than what we...
Healing Hands Health Society presents Dental Webinar Series. We have planned a series dental webinars to keep you abreast of current practice. This series on prosthodontics will be via Zoom, Facebook Live. Presenters are drawn from dental schools in the USA, private practitioners from around the world. To register for future webinars, visit www.hhands.org/dental-training. For future inquiries, contact Facilitator